Hi, everybody. Thank you all for having me. Thanks for bringing me here. As I was previously introduced, my name is Emma Persad. I'm a Cochrane Governing Board member, and I've also been working with Cochrane Austria and Cochrane Sweden since 2017, so for quite a while now. I'm a doctor by education, and I'm doing my specialization in public health, and I'm currently doing my PhD at Karolinska in Sweden. So I was asked here today to talk about Cochrane's role in supporting creation of national guidelines and rapid recommendations. And I know we're a little bit short on time, so I'm going to try and keep a good pace. So let's get started. Is it the? Oh wait, the big word. Okay, now good. Thank you. So just starting off, obviously I was asked here on behalf of Cochrane. So my conflict of interest is that I am a Cochrane Governing Board member. So I want to start off by asking a very, very simple question, and you might think that it's a bit ridiculous that I ask this, but I think it's actually very relevant. My question is, what actually is the Cochrane collaboration? I think a lot of you might have a bit of an idea of the name, or somebody once came up to me and said, you do something with volunteers, right? Like that. So there's a lot of misunderstanding about what Cochrane does, whether it's at an international or a national level. And so I'm just going to briefly go through a little bit of what Cochrane actually is. So an international network with over 100,000 members. I believe we're at about 110,000 now, in over 190 countries. And it's a mixture of everybody. It's truly a collaboration. We have researchers, we have care workers, we have patients, people interested in furthering themselves in evidence-based medicine. And everybody's coming together for this common goal of trying to improve health outcomes for everyone, everywhere. Alongside that, we're also an independent charity, so we're registered in the UK and a non-for-profit organization. And with that, we don't accept any sort of commercial funding, so everything that we do is really out of our own goodwill. And now, why is Cochrane important? So for over 30 years now, we just had our 30-year anniversary, we've been kind of putting together the methods and summarizing best available evidence to inform healthcare knowledge and decision-making. And we really want Cochrane to be at the heart of decision-making, and we've established three main goals: to produce trusted evidence, to advocate for the evidence, and to be able to inform healthcare decisions. Now, going a little bit more into why I was asked to speak here today, Cochrane's role in guideline development, I will start with that and go on to rapid recommendations in my later section. So if we look at Cochrane's overall guideline development work, I would put it into there are three pillars that kind of make up how we contribute to guideline development. The first is the production of these trusted evidence syntheses or reviews. We also have this aspect where we're continually developing methods of guidance. And those methods aren't just used by Cochrane, but they're used by everybody. Anybody can do a systematic review and apply Cochrane methodology, which is a really big part of developing evidence-based medicine in different countries. And the third pillar is with regards to our training and engagement. So we have a very wide, passionate, extensive network. And I think that these three items taken together really put us in a key position to support guideline development. And I'm going to start with the first pillar there, which is the reviews. So if we look a little bit about, and ask ourselves, are Cochrane reviews useful in supporting guideline development? Well, there's some data to say that they really are. So if we look at the Danish Health Authority, which isn't necessarily indicative of all health authorities, but in 2022 they published a paper and they found that approximately 1/3 of the Danish recommendations were informed by Cochrane reviews, and that actually for nearly 2/3 of these recommendations, the Cochrane reviews were actually able to inform on all critical outcomes. So that's very positive. If we take it one step above and we look at the WHO, as we have Margaret here, they published in 2016 that actually 90% of the WHO guidelines actually contained Cochrane evidence. And they specifically mentioned that 474 reviews informed 160 WHO guidelines. So that being said, you can already say that Cochrane does have a place in guideline development. Now, some of you might be asking, I really want some data, I want some nitty-gritty facts, and I can give those to you. So if we can look at the number of citations in guidelines, we can look at it this way. So there are 9,136 reviews in the Cochrane database of systematic reviews. Of those, 6,543 have received at least one guideline citation. And these reviews have received overall over 39,000 citations and guidelines so far. So taken together, those reviews average about 6 guideline citations per review. So we would like to say that we think that we have a good place in supporting guideline development, and we hope that this might be something that also the Czech Republic is able to take into consideration as well when doing their guidelines. Just a graphical representation of the increase over time. So positively, it looks like our reviews are being more and more cited in guidelines as time goes on. I'm going to switch gears now and look more at the method side of things. So if we ask ourselves if Cochrane methods are useful in supporting guideline development, well, we come back to the Danish Health Authority and the study that they published, and they actually said specifically that the authority's methodology for guideline development is actually based on the recommendations from the Cochrane Handbook. So that's a very positive reinforcement of the work that we do with methods and how that can support guideline development. And I think if we take this even further, I would argue that Cochrane methods have definitely set a standard in the evidence-based medicine community, so not just within the Danish Health Authority, but just generally. And by that I mean with regards to screening, data extraction, risk of bias, all of these things are things that we can implement when we're doing guidelines and when we're bringing evidence-based medicine into our different countries and our different societies. And I believe that Cochrane has played a role in really standardizing those methods. Now let's move on to training. So is Cochrane training useful in supporting guideline development? I would say so. We have a very, very big online training database. So if I start with that, Cochrane training and interactive learning, those are both online resources. We have training for both beginners who are curious about how to do a systematic review, and also training for people who need to strengthen their experience, people working in university, public health settings, health policy settings, wanting to learn more about doing systematic reviews in evidence-based medicine. And if we look over time at the amount of people attending our live webinars, you can see that it dramatically increased in 2020 during COVID, and it still has just continued to kind of increase, a little bit of a dip in 2022, but generally speaking, a lot of people are really attending these webinars and trying to learn more about evidence-based medicine through what we can offer online. Now, if we look back at the country-level training, our country-level offices are really, really instrumental in delivering evidence-based medicine education. So a lot of our offices offer local workshops, sometimes also provided for university credits. They also offer workshops for public health authorities, health policy makers, and there's training and the provision of knowledge translation, which is very important to be able to relate Cochrane evidence into your own languages, or any kind of evidence into your own languages. And also the establishment of networks like, for example, the Grade Scandinavia network. I know that you're also involved in a network here now in Czechia. So I think all of this taken together, there's a lot of work done at the country level, which is very important for national, both boosting morale for evidence-based medicine and also boosting for guideline development. And just generally speaking, how does training actually relate to guideline development? What is the connection there? Well, in my opinion, training also, it allows us to develop sound methodology really at a country level. And with that methodology, then we're able to share it between people, organizations, all these different parties. And it also allows us to introduce this methodology to the next generation, which is very important. So, for example, being able to introduce it to students, people who are early career professionals, or also people who are in low and middle income country settings. If we're able to train these people from the ground level up, then that will strengthen our health systems and be able to influence and strengthen these people who might be working with guidelines later on. So that's, I think, a very positive takeaway. So if I move on to the second section, which has regard to rapid recommendations. Now, I think the one thing, if anybody knows anything about Cochrane, the one thing we can probably all agree on is that Cochrane reviews are not rapid. This is definitely not something that we are. So they're thorough and they're robust, but they take a lot of time. And so that's something that we've been trying to address and work on, because we want to have reviews that are of high methodological quality, but are also produced quickly, so to say, or in a time-sensitive manner. And these are important for, emergencies, other time-sensitive decisions. Maybe there's a national request to do something very quickly. Also pandemics and epidemics, as we saw with the COVID-19 pandemic, how important it was to produce evidence, trusted evidence, quickly. And also to keep Cochrane relevant. You know, a lot of people know how to apply our methods now, which is great, but we also need to be able to keep up and be able to still deliver and meet the needs of our stakeholders. So if I look more towards the methods aspect of this, so these rapid evidence syntheses are gaining prominence, but they're really poorly understood. And so what we did in 2015 was actually start the Cochrane Rapid Reviews Methods Group, and their prerogative was to inform rapid review methodology. And they actually did this by publishing Rapid Reviews Guidance in 2020, and this was kind of a publication so that people knew how to do it during COVID, and it's currently actually being updated now, so stay tuned for that. But just generally speaking, it started the conversation of, okay, you know, obviously we'd like to be able to take the time to do these reviews, but maybe there are corners that we can cut where we can still try to produce reviews of high methodological quality. Another thing that we've come up with is Cochrane Response. So this is a team that usually responds to requests that are commissioned, and they can provide a tailored, more rapid evidence service. So within methods, this is something that we're really trying to develop so that we can be a bit of a front runner in the methods that should be in place to do rapid reviews. Now, I want to speak a little bit about COVID-19, just one slide, I promise. So something that you might know is that Cochrane is a WHO collaborating center. And a nice story is that when the WHO announced that the COVID-19 was in fact going to be a pandemic, within 10 minutes, Carla, the editor-in-chief of the Cochrane Library, she received a phone call from the WHO, and they said to her, you know, we need you now, we need Cochrane now, we need evidence, and we need it to be trusted. And I think that's a huge responsibility, and we were able to deliver on it. And it was really incredible. I think everybody within the Cochrane community can agree that it was really amazing that people really dropped everything and started doing reviews on COVID and developing methods in that. So we were able to respond to the needs of guideline developers in a timely manner. Of course, that took a lot of resources. And we had a very diverse offer. So far we've produced 54 reviews. Some of them have been updated multiple times. We did reviews on diagnostic test accuracy, which is quite novel. We had a COVID review bank highlighting reviews that should be done. We also offered Cochrane clinical answers to people working more within a clinical field. And we also put together a Cochrane COVID-19 study register as well, so that people could look into the databases of COVID studies that were being done. So that's a little bit about our role in guideline development and rapid recommendations. And I wanted to start to close up this presentation with a little bit of a discussion of how we are actually doing. How is Cochrane doing right now? And what are we doing well? So if I start with this, we have a devoted network of passionate contributors, and we offer training, we offer resources for development, we collaborate with stakeholders, and we try to respond to their needs as quickly as possible. We're also well respected and we're recognized. And with adequate resources, we can respond in a timely manner. Now, with that being said, what can we improve on? So we found that there are large discrepancies in review topic areas that are used in guidelines, and that means that there are Cochrane reviews that are missing, that are not covering the areas that guidelines are covering. And guidelines are really important because they can also identify gaps in which we can also do Cochrane reviews. And I think something that's really interesting that was brought up by Zoe is that this collaborative effort, for so long it's been people working in their own line, but I think if we're able to come together and not duplicate efforts and really be able to see what is missing, how can we do it, and how can we do it well once and not have to keep, continuously be doing it multiple times on different parallels. So I think that's a really interesting space to be able to explore with regards to these other organizations that are doing very similar work, and how can we put our efforts together. And with that, I would also want to mention joint initiatives. So I have written Campbell Collaboration and JBI down here, and Magic App. These are living systematic reviews. There's so many both methods and organizations that are very exciting and that are doing very interesting things that are very similar to us. And I think through collaboration, we will be able to better affect the evidence-based medicine community. And also what we can improve on, keeping ourselves relevant, both with regards to the topics that we're doing and the response time it takes us to be able to do those topics. And getting back to this, being able to respond more in national settings. So every country has their own prerogative and what they need to be, what they need to do in terms of guidelines and how much they want to use Cochrane evidence or not. And I think that we can take it on a case-by-case basis. And in the countries that can really use Cochrane support, we can be more involved to really help them build up their guidelines, for example. Now, what are we currently working on? This is a very broad aspect, so not just related to guideline development, but just like Zoe mentioned with JBI, we're redoing our scientific strategy, and we're trying to make it more focused on global health priorities. So, priorities that are really interested to entities like the WHO, for example, and trying to put more of a health equity spin on the topics that we're doing. We're also working to become open access. Right now we are 81% open access, but of course we would like to be 100% open access. As I said, working to expand diversity within the community. So equity is actually an aspect of our new review format, which is being launched. It's actually already available, but it will be, all reviews will follow this format in January of next year. So all reviews will have to have a section that talks about the equity and how the results can be applicable to different populations. And also continuing to develop our methods. So one example could be, well, if we think that rapid evidence syntheses are the way forward in some situations, then making sure we have, robust methodology to be able to combat the risks associated with, taking these shortcuts to be able to produce the evidence in a more timely manner. Now, I want to end this presentation not with a summary of what I've already told you, but a bit more of a kind of a discussion point and something to leave you with. And at the heart of it, Cochrane is really a collaboration, and we're a group of researchers, patients, carers, a network of people. And so that's why I really want to ask the question: what do you think? What can we be doing better? How would you like to be engaged? What would you like to see us be doing? And we would really like to hear from you, no matter what your experience is, and especially as we're developing our scientific strategy and trying to really rework the way that we've been doing things. We're really interested to hear what the community thinks and what they need from us as well. And with that being said, I want to point out two upcoming things going on. So as I said, I'm a part of the Cochrane Governing Board, and we actually have two board spaces that are opening up. The elections will be in November, December. They haven't announced a time yet, but I would really encourage people to apply if they've been thinking about it before. And you're more than welcome to reach out to me if you'd like to get some more information about what the Cochrane Governing Board does. It's, as you can tell, I'm quite young, and they're really working to push diversity, and young people and people from all different kinds of backgrounds are really welcome to apply and to become a part of the board and shape some of the decisions that Cochrane is making. So I'd very much encourage you to reach out if you have any questions about that. And I don't think I need to tell you this, but the other opportunity to engage, well, you have the Global Evidence Summit coming up next year. It's so wonderful to see so many of you here today and over this conference, but I'm really encourage you to engage as well at the Global Evidence Summit. If it was anything like the Cochrane Colloquium was in London this year, it's a really exciting coming together of like-minded people to really not just all agree on things, but to really combat each other and really push, evidence-based medicine going forward and, for years to come. So it's a really wonderful experience, and I would really encourage you to be here for that. Yes, so I'd like to end my presentation here. I took this picture, as you can maybe see in the background. It's actually Westminster Abbey. So this was during the Cochrane Colloquium in London. And the conference center was right downtown, right by Big Ben, Westminster Abbey. Everything was we were right there in the heart of it. And they had these Cochrane flags flying overhead. And I have to say that I don't know about you, but this makes me very proud to be a member of Cochrane. To just see it like that. So I encourage you, if you're a bit curious and maybe you're not a member or you'd be interested in being one, to reach out. And obviously you have really good people on the ground here to be able to provide more information for you. So yes, thank you for your time.